Started 2 minutes.
Next page, ma'am. Next page, ma'am. This is the last page, ma'am. Any other thing?
No.
First page.
Started your timing.
Hi, I'm Dr. Muthulakshmi, one of the ST5 doctors posted in the clinic today. How may I call you?
Yeah, my name is Modivi Sikujwabe. So you can call me Modi.
Okay, Modi. What, can I confirm your age, please?
Yeah, I'm 30-year-old.
Modi, at the outset, I apologize. You have come here to meet Dr. Patchett, and he is not available at the moment because of the unavoidable circumstances. Is it okay? Shall I proceed consultation?
Okay.
Okay. You have been referred by a GP letter, and you're pregnant, and you're here to discuss about delivery plan. Am I right?
Yeah.
And Modi, since we are meeting for the first time, and shall I ask few questions to know more about you?
Yeah, doctor, it's okay. Go ahead.
Okay. Modi, so please tell more about the current pregnancy. How far is it going?
Yeah, doctor, this is my planned pregnancy. I'm 34 weeks into my current pregnancy. All everything is normal up till now. I had my recent scan at 28 weeks, and it is everything is normal up till now. Nothing to worry about it.
Okay, good to know. And have you named your baby?
No, doctor, I haven't.
Okay. So is the baby moving well inside?
Yeah, yeah, everything is normal.
And any tummy pain now?
No, doctor.
Okay. So any problem with your water work or a bubble?
No.
So, and you said that recent scans done at 28 weeks. So are you aware of the baby weight that time
Yeah, they mentioned that it is 2.8 kg.
at 28 weeks, right?
No, just recently they had done it, so it might
Okay.
be okay.
Okay. So are you aware of afterbirth position, water level, anything?
Um, that said, everything is normal.
Okay, so fine. So could you please tell more about your first pregnancy?
Yeah, doctor, actually, my first pregnancy was spontaneous, normal, and I waited till 41 weeks, but I didn't went into labor. So they had admitted me. Uh, although they didn't induce me, slowly they started with some, I'm getting started with pain, but it was very slow progress. At 8 centimeter, I was stuck up for a prolonged time. Then they started me on oxytocin, but my baby's heartbeat was dropping. So, and I was not opening up, so they rushed me for cesarean section. And my baby was normal, 3.4 kg.
Okay.
But that emergency cesarean section was very bad. I means bad experience, doctor, because it was something means they rushed me. They my partner was not there, so that's the reason I'm just afraid of this time also going for a similar situation. I wanted to avoid similar situation this time, and that's the reason I wanted to know what is best for me.
So, okay, Modi. So this time we'll take you all the precautions, okay, to reduce all those experiences you had in post pregnancy. Okay, so don't worry. We as a team are here to help you.
Thank you, doctor.
Okay, so your first baby is doing well now.
Yeah, doctor, he's fine.
And how was your recovery after the cesarean section?
Oh, yeah, I went home. The recovery was fine.
So shall I check your notes with your permission?
Yes.
So is there any known medical conditions?
No.
Any medicines apart from pregnancy supplements?
No.
Any surgeries other than the previous
No.
cesarean? Any
No.
allergies?
No.
You have a personal or a family history of clots?
No.
So are you aware of your height weight ratio?
It's normal.
Okay. Blood group?
A positive.
Any reservations you have transfusion in case need?
No.
Okay. And what do you do for your living?
I'm a school teacher, doctor.
Okay. So, and are you well supported at your home?
Yes.
Okay. So, Modi, so you have come here to discuss about the delivery options. And are you aware the options someone explained you before?
No, doctor. I just wanted to know means in detail.
So, coming to the options we have, so we have a two. One is going for a labor, normal labor. So that is called a trial of cesarean section. Another one is going for an elective cesarean section without
Trial of
going for
cesarean
labor.
section. Trial
Sorry?
of cesarean section or cesarean scar.
Sorry?
Trial of what is that, doctor? Trial
Yeah,
of labor or trial of
yeah,
cesarean section.
yeah. The trial of labor is like after cesarean sections, we go for a normal labor. So that is called a trial of labor after cesarean section. Another one is to go for an elective cesarean section straight away.
Okay.
Okay. So coming to the first option. So first option is going for a normal delivery. So that is thing like the chances success is about 3 in 4, and 1 in 4 women might need an emergency cesarean section.
Oh my
Okay.
God.
Okay.
I don't want to go for that emergency situation, doctor. It is rush timing at that time.
Yes, yes, I can understand that. So the concern we have is like we need to monitor because there is 1 in 200 chance the previous car can rupture. So in those situations, we need to go for an emergency cesarean section. You and your baby's will heartbeat will be continuously monitored. If that situation arises, we need to go for an emergency cesarean section.
Okay.
Am I clear so far?
Yes.
So the benefits is like it's faster recovery, it avoids complications of surgery and the anesthesia, and it increases vaginal deliveries in future. Okay, so and another concern we have is, and sometimes when we su- suspect some the previous core is getting ruptured, so sometimes it may be very rarely life threatening for the mother, it causes increased bleeding, and for the baby very rarely there will be a less oxygen damage to, like less oxygen supply to the baby,
Oh my
and very
God.
rarely death of the baby can happen. I'm not scaring you, so I wanted you to be aware of these complications.
Oh my God. Yeah, doctor. Okay.
So, am I clear so far?
Yes.
And another option is go for an elective cesarean section. So that is safer for the baby, eh, and it avoids a problem of scar rupture. But it's a major surgery. It has complications of surgery and anesthesia, like injury to the nearby structures, bleeding, infection, and the clot formation. And the long-term risk is it increases cesarean section in future and complications like stickiness of the organs around, and also stucking of afterbirth to the womb.
Okay.
Am I
Okay.
clear so far?
Okay.
So I'll be referring to your VBAC clinic, okay, and I'll book an appointment with the consultant where the team of experts, okay, will discuss with you the options again. And we'll also do one more scan at 36 weeks to check the baby weight, afterbirth position, and water level. So the
Hmm.
final decision between you and the team of doctors. Am I clear so far?
Okay. Yes, doctor.
So you have any concerns till now?
Uh, yeah, doctor. What will decide if I go in labor that I'm going to have a successful delivery?
So yes, so generally, the spontaneous labor is a welcome, so it increases success of normal delivery. Okay, and also the baby weight. Okay, so and we just check the neck of the womb at the time. So how it is softened, how much it is open. So if it is softened and it is open more than 4 centimeter, again it increases the success.
Okay.
And in case you are not going for a spontaneous labor, so the option of induction of labor will be discussed by my consultant. So we might not be able to give the some medicines which are put vaginally in this situation because it increases the risk of scar rupture and increases the risk of cesarean section.
Okay.
Am I clear
And
so
if
far?
I opt for cesarean section, when you will be doing cesarean section?
Yes. So usually it will be done after 39 weeks of gestation to reduce the breathing difficulty for the baby.
Okay. Okay.
And in case you are going for a, sorry,
Yeah, it's okay, doctor. No worries. Yeah, go ahead.
in case you are going for a like normal labor, and again it will be in a consultant led care unit, okay, with one-to-one midwifery care, continuous monitoring of you and your baby's heartbeat.
Okay. Yeah.
And you can also discuss the pain relief options with an anesthetist.
Thank you, doctor.
Okay. So, and also give a detailed information leaflet. I'll book an appointment with the consultant and I'll write back to your GP and document in your notes. And I'll connect to the counselors and support groups. So they will share their experiences about the previous cesarean section and the normal birth after that.
Okay. Only 20 minutes extra, 20 seconds extra. Overall, a good presentation. Okay. Your own reflection. Please comment on her performance. I want everyone to comment on her performance. Okay. Okay. So your own reflection, Dr. Muthulakshmi.
I prepared, so so I know like what to tell.
Okay. Good.
Mm.
Hmm. So you know that you have done it very
Ma'am,
perfectly. Hmm? Yes.
would it have been wiser to ask her preference for the mode of delivery? Like you
Yeah,
said,
you can
you don't
ask. You
want.
can ask. Yeah, you can ask actually. Basically, here we are not counseling her for pro VBAC. At the same time, we are not counseling her for the pro cesarean section. I'm confused. I'm
Yeah.
confused, but I wanted to avoid that the similar situation what I had in my previous pregnancy. But you know that the previous cesarean section for dystocia will have lesser chances of VBAC. It is an there will be a lesser chances of
Absolutely.
success with VBAC. So that one point will be there where we need to ascertain her that also.
Yes.
Okay, so that one point only
Also,
you missed out, huh? So you can
also,
ask her
if
what are your views, what are your preferences? Do you have any preferences? So here I will just say no, I have not yet decided, but the midwife said to me that vaginal birth will be an option in my case. But I wanted to avoid the risk of surgery, emergency surgery. So in that case, yes, you just need to tell her that since means okay. So if you are having that concern that you wanted to avoid that, so you can avoid emergency cesarean section by planning your section at 39 weeks of gestation. That is an alternative options. But then the pros and cons, you just need to explain her that these are the pros, these are the cons, and how many kids you want. One more question: how many kids you want in your future? Okay.
EMI effect
and
also this.
when was the last cesarean done? Did she ask, or maybe I missed it?
No, it's okay because inter means that is not an important thing actually.
Okay.
Okay, because
EMI
that
not.
it
And
yeah that even RCOG doesn't support short interval. They should go if there will be a short interval. They should go for elective cesarean section. They also do not support that theory. At least less than 2 year, it's a short interval in between two pregnancies. They do not support that they should go for elective cesarean section. They do not support that scar thickness measurement also. So here actually. Even in the role play instruction, I don't remember they had mentioned how old is her first baby. Okay, so let's assume that
and
it will be more than 2 year. Let's assume. Okay. Yes, dear.
okay, and ma'am, is it important to do an examination at the moment? Like
No,
she
not
did
needed.
not,
Not needed.
not needed.
Because
Okay.
Counseling.
she had come to discuss her options. She is following up with the midwife regularly, so that is midwife job
All
to.
right.
Okay, so that is midwife job to keep a watch. She had her recent scan, it was not at 28 weeks, must be around 20, 34 weeks. So she is following up whenever they wanted. This is counseling task. So in the RCOG in NHS they do not offer examination like we do in our own countries. Whenever patient comes to you, you will always offer
Yeah.
examination. Those tasks, no, not needed. If the patient had come, you just examine her. Here, this few history was also not needed basically. Okay, but it's okay. Pain, bladder bowel
Madam,
symptoms,
No,
leaking,
yes.
not needed. She's
Okay,
not
ma'am.
having any.
Hmm.
She has come straight forward. Okay, so how is your baby movement? Any means then current pregnancy, previous pregnancy, accessing case details, medical surgical risk factor, BMI, blood group. Smoking. Okay. Max to max smoking you can
EMI
ask.
is illustrated.
You asked. No, you
Yes.
asked.
BMI asked, ma'am. BMI asked.
Hmm.
No advantage of disadvantage of being more than 13 would affect the success of feedback.
Yes. So my BMI, I told her that it
Normal.
is normal.
Hmm.
It is normal. Okay.
Oh,
So yeah. So overall, she has done a good job. I will say that only few history. That clot history is not important here. Bladder pain,
Pain
plain
bladder.
history, bowel, bladder symptoms are not needed here. Okay. Then you very nicely you checked my options. What are means? Do you have any idea about the options? So very good. You checked my and you can ask here. Do you have any preferences also? Then you explained me regarding VBAC. Then you explained me regarding plant cesarean section also. Whatever doubts I had, you had ascertained all those doubts very nicely. Okay. So since a single task prepared very nicely, it was clear pass. Only few points here and there. What I had. Anybody wanted to put mention any points? What would have been extra in her case? Okay, so explore concerns worried about being in labor and ended up for cesarean section. That was my major concern here. Okay, so worry means I wanted to avoid the similar situation why what I had in my last pregnancy. And to be very honest, if she will landed up in the similar situation this time, it is very high chances because her previous section was done for dystocia. So dystocia, high BMI sections, those who are having high BMI, they are always have high risk of unsuccessful VBAC. So here we are, that's the reason here we are not emphasizing on VBAC or we are not emphasizing on plan as a section. You just need to tell her both the pros and cons. So you had explained me that. So regarding my current pregnancy, you accessed my current case details, access my previous case details, medical history, surgical history, allergy, occupation, support, smoking and alcohol. So not booking, so you can skip rest of the history. Blood group and BMI is very important. I had not mentioned here. Okay, I will mention because that is very important piece of information what you need to know. This can be skipped. Examination is not needed when your patient had come to discuss. Okay, counseling task not needed. Discuss the reports do not offer. So check her background knowledge, what she knew about VBAC or what she knew about the option after cesarean section. Okay, so both the option you can share. So just emphasize here that since she had a scarred uterus, it will be a high risk pregnancy and she needs to be continue her laboring options in consultant laid care unit where there will be access to CTG, access to OT and emergency services, whether it is VBAC or whether it is planned LSCS. So her options will be either a VBAC and planned LSCS at 39 weeks of gestation. You then and there only you say dear, rather than allowing the role player to ask you extra question. Okay, you didn't mention that when I asked you, you mentioned that. So you mentioned then and there also, there only, that elective LSCS at 39 weeks, so that the baby's lungs will be matured, more matured. So pros and cons, you mentioned everything, I don't say. But then there is this VBAC score which will assess the success of VBAC. What are the VBAC score? Anybody?
Age,
Hmm.
BMI, spontaneous labor,
Hmm.
baby weight,
Previous, no, previous,
previous vaginal delivery.
yeah, previous vaginal delivery. So
Previous.
previous vaginal, 5 points are there, but at least previous vaginal delivery, the when you present in labor, that means active labor. Okay, so if you presented in labor, active labor, then and the BMI less than 30. Okay, so this will predict your ability to go for vaginal labor, vaginal birth. Okay, means more chances of successful vaginal birth. But induced labor, no previous vaginal delivery, BMI greater than 30, previous cesarean section for labor dystocia are associated with increased risk of unsuccessful VBAC. Okay, that's the reason I put this section point. And planned elective section, yes, it can be done under controlled condition. We can avoid the risk of scar giving way, but yes, there is a risk of surgery, risk of injury to the nearing organ, future risk of repeat cesarean section, placenta previa and accreta, and even breathing problems in the babies also. Okay, so those are the problems, childhood obesity in the newborn. So all those problems will be there with this. So if I go past date, what will be my option? So if you will go past date, then we will discuss either going with the option of elective LSCS or induction of labor. That will be decided by consultant, because risk of uterine rupture and requiring cesarean section increases 2 to 3 fold. Okay, 1.5 fold will be the uh, with rupture will be 2 to 3 fold, even requiring cesarean section is also very high. How you can predict whether I am going to deliver successfully? So this is VBAC score, admission Bishop score, age, previous cesarean delivery, delivery indication, body mass index, and previous vaginal births. If I want to have a cesarean section, yes, you can have it at 39 weeks of gestation. Referral to VBAC, leaning for proper counseling, arranging an ultrasonography which you had arranged very nicely, continue electric, so one-to-one labor care, continue fetal heart rate monitoring, epidural analgesia, review by anesthetist during labor, and one-to-one care will definitely be offered if she opts for VBAC. Uh, Close the loop with patient information leaflet with birth options after previous cesarean section. Now she's at 34 weeks, so at again we will arrange ultrasonography, and 37 to 38 weeks of gestation. With VBAC clinic consultant, we can decide further what suits her better, whether it's a planned cesarean section or a vaginal birth. Okay. Anybody is having any question?
No, ma'am.
Thank you.